Hey everyone, Dr. Haverland here. We'll get started in just a few minutes. Hey guys, we'll start shortly. I'm just going to give a few more minutes to let a few stragglers in. Hey everyone, thanks for meeting with me today. This is our May webinar, and today we're going to talk about something a little bit different than what I normally talk about. And so this is going to be the next hour talking about how to effectively manage endometriosis-related inflammation without surgery using proven, evidence-based, holistic methods that provide real relief. And, normally I'm a surgeon. We talk a lot about surgery, but I do think that it's very important to make sure that we're talking about all of the less invasive options that we also have at our disposal. So many women facing endometriosis want relief from inflammation and pain, but surgery isn't always immediate. Sometimes it's not desirable or even feasible. So this is an alternative for effective non-invasive solutions, talking about management of endometriosis inflammation. And so imagine dramatically reducing inflammation and pain naturally with gaining control over your symptoms without invasive procedures. And of course, sometimes invasive procedures, are required to get full relief. But on this next hour, I really want to focus in on some of our non-invasive options to help with inflammation and kind of in a holistic, multidisciplinary approach. So, you're tired of inflammation related pain just dictating your life. Painful periods, bloating, digestive issues, fatigue is a very common symptom of endometriosis. And they may all feel unrelated, but inflammation is often the hidden culprit, kind of the underlying etiology behind all of these symptoms affecting your bowels, your bladder, and your daily functioning. So we do have options for treatment without opting for surgery or heavy medication, and sometimes these medications only masks the risks. So stay with me for the next hour, and let's talk about some of these less invasive options that we have to help and with a holistic approach and evidence-based to help with some of our pain symptoms that we're feeling, especially with chronic diseases like endometriosis. So first of all, I wanted to introduce myself. So my name is Dr. Rachael Haverland. I am with Endometriosis Center of Excellence here in Dallas, Texas. And we focus on a multidisciplinary approach and way to treat endometriosis. And this is not a one-size-fits-all. Every patient with endometriosis has different symptoms. They present differently, and they're not all treated the same. And I think it's very important to have individualized treatment and really speak with the patient individually and understand that this is not a one size fits all. And as we go through some of these options for less invasive holistic treatments, they're also not going to work for everyone. And it's not a perfect balance for each person. And I think, again, that's why it's so important to make sure that we are really treating the individual with individualized, specialized treatment, focusing on each patient so that we make a plan that gives you the best outcomes. So if endometriosis-related inflammation disrupts your life, stay tuned. There are powerful, proven methods to manage it naturally. So don't you know that women with endometriosis, almost all of them have inflammation. At least 80% of women have laboratory values that are showing inflammation with endometriosis. But surgery isn't always necessary, and sometimes it's not completely effective. Sometimes we need to implement other less invasive options to help get the best outcome. So I'm Dr. Rachael Haverland. I am an endometriosis specialist here in Dallas with the Endometriosis Center of Excellence. And not only am I a surgeon, which I do find, treatment through surgery, but I also am an integrative physician. I talk about holistic approaches in a multidisciplinary way to treat endometriosis, not just surgically, but also less invasive ways to treat the inflammation. And you can get real relief. This is evidence-based, proven options for relief from endometriosis symptoms without having to have immediate surgical intervention. So by the end of this webinar, you'll learn about practical, non-surgical inflammatory management strategies, including diet, acupuncture, physical therapy, yoga, lifestyle modifications. And at the end, I'll give you an inflammation reduction starter guide. So you'll get this for free in order to kind of review what we talked about and how to implement it into your journey here. Also, to note, I would love for this to be interactive. So for the next hour, I will try to talk to myself through this computer screen, but I would love for you to be interactive through the chat. So ask me questions if something doesn't make sense, if something feels like it is personal to you and you want to share it with a group. I would be happy to have that on the chat. I'm also going to place in the chat a little bit later how you can book with my surgery scheduler to go through and kind of get an appointment with me. So I'll make sure to put that in. But I would love to get to know some of you while you're here. I guess to start, can some of you tell me where you're from? So I am in Dallas. But I treat patients from all over the country. I can tell I have kind of a map. I've treated patients from Michigan, Canada, California, Arkansas, Missouri, New Mexico. Most of my patients are from Dallas, but I had one from New York a few weeks ago. But we have patients from all over. All right. So yeah, Dallas area, Aubrey, Arlington, Austin. Yeah. Some of my patients for tomorrow for surgery are from Austin. Let's see, Fort Worth, Houston. Okay, originally from Canada. We do have some patients from Canada that come through because sometimes it's really difficult for them to get endometriosis care in Canada in a timely manner, at least. Iowa, Grand Prairie. Oh yeah, Louisiana. I forgot that one. But yeah, Louisiana, New Mexico, Oklahoma, we get a lot of patients from like the surrounding states, but a few from the further states as well. Missouri, we've started to have a few more patients from Missouri and Arkansas as well. Um, All right. Well, let's get started again. So again, I'm Dr. Rachael Haverland. We are going to discuss over the next hour how to implement holistic and non-invasive measures to treat endometriosis. And again, like I mentioned, this is not a one size fits all. Everybody has really an individualized approach. And when I meet with a patient, I hope you feel that way, focusing on where your symptoms are, what we need to work through for next steps. And then, if we implement this and ultimately have surgery, a lot of times we do go back to this holistic and disciplinary approach because that's when we get our best outcome, is when we're really tackling this inflammation from all sides and from as many ways as we can. Sometimes surgery is a cure-all, and that's amazing. But plenty of times, this endometriosis has caused some chronic damage to our nerves, to our muscles, and it also takes a very long time, even after the endometriosis is removed, to let the tissues remodel. Sometimes even up to a year. Nerves also heal very, very slowly, and so we have to make sure that we are giving your body time to heal while reducing this inflammation so that hopefully it can heal in a way that which your pain improves and your overall quality of life improves, because ultimately that's the goal. The goal is to get a better quality of life and learn how to have longevity for long term, because endometriosis affects so many women, not just mentally and physically, but can affect work, can affect relationships. And if we can tackle it, kind of head on with this multidisciplinary approach, usually that's when we get our best outcomes. And so the first thing I'm going to talk about is diet. And some people roll their eyes and get a little intimidated, but this does not have to be really difficult. So there's a misconception about diet, that diet has minimal impact or medication or surgery is necessary. And that's actually not true. Food is medicine. What we put into our body very much is medicine, and it affects us and it impacts us. Diet is a difficult thing to change, especially in our society, because it's not easy to eat clean and healthy, and it's also difficult socially. Like if you're wanting to go out to eat, sometimes there's not great options, to choose healthy and clean foods. I had a young woman in my practice probably about 5 years ago, and she came in with just debilitating endo symptoms. She'd already had surgery for endometriosis. We knew she had endometriosis. At that point, it wasn't completely excised, but it was treated nonetheless. And she just finished surgery and she was not feeling better. And we talked about this. We probably talked about it for 45 minutes. We talked about diet, and I usually start with a whole foods diet. So it's pretty simple. Eat foods that look like they came from the ground, clean vegetables, fruits, not things that look processed, lean meats, food that look like kind of where it came from. You don't have to cut out, every gluten and dairy and soy to begin with, but starting with kind of whole foods diet and starting to tease from there. But we talked about diet. We talked about kind of what she's eating. She was a college student, so it's difficult for her to to eat well, but also at that point, she didn't really understand the importance. This patient, she amazes me, and it still impresses me to this day. After that visit, she went and got some books and started reading about this whole foods diet. She met with a nutritionist, and I met with her again and 4 months later. So I gave her some time to implement this to help us decide what our next best steps are. And she was living almost a pain-free life at that point. And the only thing she had changed between then and when I saw her the first time, and that was her diet. And she was pretty dramatic. She changed, she went gluten-free, she did dairy-free, she also did soy-free. She found out that those were her triggers, but she found a way to implement this very strict diet in her life and saw a huge improvement. And I checked in with her, every year for the next few years, and she was very consistent with that. And her pain actually was able to be kept at a dull roar. She didn't need to do any medications. She ultimately has not had surgery yet again. And she's feeling great. And it's not easy, and not everybody can have that perfect outcome, but it is possible to make dramatic changes with your diet and see dramatic changes with your pain. So food is not just fuel. It is a powerful medicine that can directly reduce inflammation and improve your quality of life. And people ask me, they're like, okay, so which diet am I going to use? Tell me which diet, doctor, is going to like decrease my inflammation and help me. And if I had this magic diet, I would be, I would be on a yacht somewhere. Women with endometriosis tend to have more food sensitivities because endometriosis is very much of a chronic whole body inflammation. Yes, we see it in the pelvis, but it is a whole body disease. And so it affects the bowels, it affects the bladder, it affects fatigue, and daily energy. But it certainly can cause women to have more sensitivities to food. Women frequently with endometriosis are diagnosed with IBS, whether they truly have IBS or if it's just endometriosis affecting their bowels. Sometimes it's hard to tease out, but this food sensitivity can be very common. And so, but not everybody digests and tolerates food the same. A lot of, I definitely recommend cutting out, processed foods that, have a lot of preservatives in them. Complex carbs are a good place to start, cutting out breads and pastas, but doesn't mean you have to go gluten-free or cut out all carbs. But some of those like more processed breads and pastas are a good way to start. Really sugary foods like our favorite Starbucks drink that has all the syrups in it. Certainly I'm not saying take away everything that you love and everything that brings you joy when it comes to food, but kind of starting with clean eating and kind of this whole foods is a good place to start. And then you can start to pull out different foods. Hey, if I go gluten-free for a month, how do I feel? If I take out soy for a month, how do I feel? Does dairy make me more bloated? Kind of trying out different foods to see what works best for you. Because again, it's very much not a one size fits all. People always are looking for this anti-inflammatory diet, which there certainly are foods that tend to be more inflammatory, but it's not the same for everyone. I can eat, soy and it doesn't affect me or make me bloat, but another person sitting next to me certainly may have a completely different reaction. Same thing when it comes to dairy. And so I do think it's very important to know your body and start to learn some of those triggers that are affecting you. And it may not just be that day. You may not see symptoms that day, but throughout a full cycle, you may be able to notice a difference. And that is ultimately the goal, is to find foods that work with our body, that are medicine, that are helping us go towards the ultimate goal of decreasing this inflammation, which ultimately decreases our pain. And so I am going to look through some of these questions. And again, y'all, please put some questions in the chat so that we can be interactive, or as much as possible. Okay, so one of the patients asked if she stayed on birth control. So this patient actually was not on birth control. She had adverse side effects to birth control at the very beginning. So she had tried birth control for a while and then ultimately didn't. She had a surgery with like a combination of ablation and excision, and 6 months out, like still was just not seeing really any benefit. And that's when she implemented the diet changes. And she had pathology proven, endometriosis. And I think she had some adenomyosis too, but her pain was able to be managed with diet alone. And she was also implementing some acupuncture, and we'll talk about some of these other things later. But diet was her first change that showed her the most benefit. And again, diet can be so difficult because you go over to your friend's house or your mom cooks for you, and you don't want to be rude, but you may not have foods that they work well for you. And even though it's not a true allergy, for us, food is very social. But remember, your body is worth it. Your longevity is worth it. And if eating, this one thing is going to make you flare for the next week, you have to decide if that's the best option for you. But I do think that it's really important to at least discuss. And again, remember, this does not work for everyone, but I have many patients that do it. I will say, out of all of these holistic approaches that we're going to talk about, diet is the hardest one to implement. People want to do it, but especially in our society and how social it is, sometimes it is very difficult. But if you find a network of people doing it with you, like if you can get your spouse or your partner or your roommates or your friends to help support you in this, it becomes a lot easier because you're all eating together. So it can still be social and you don't feel so alone. And food can still bring happiness, even when it is like cleaner food. You can certainly find food that's not as processed, that it still gives you some of that joy. And we as humans very much are like that. Food is a pleasure for us in many ways. And so it's important to find that balance, not to cut out everything that brings you joy. One patient was like, I stopped drinking coffee and my pain is not better. And, I've been doing it for, over a year, but I know it can be inflammatory. Maybe it's okay for her to have a cup of coffee. She was talking to me about how it brought her joy in the mornings and she liked the warm feeling and she implemented coffee back into her daily routine and didn't notice a difference. So it's not a one size fits all. All right, so let's see. We're going to go back to the chat. Thank you guys for being interactive. So certain foods can trigger your inflammation, which worsens your symptoms. Exactly. So somebody mentioned that inflammation can, is what leads to more pain. And that's absolutely true. So endometriosis is the underlying etiology. This is what's causing the inflammation. This is what's setting off the nerves. But inflammation is technically a secondary and tertiary characteristic of endometriosis. So it causes nerve inflammation. It can cause some fibrosis, but also affect the muscles. And so diet is not going to make the endometriosis go away, but it may help you with some of that secondary and tertiary effects of endometriosis and hence some of the inflammation and help you tolerate it better. And this has been proven again and again through multiple studies. And again, it's difficult to do because sometimes it's hard to tease out which foods are inflammatory for an individual, but once you find that, I see it all the time with my patients who are able to implement this. Again, this is the most difficult holistic approach to implement, but when it's done well and it's done with perseverance, it can see big benefits and outcomes. So somebody else said, if you follow a gluten-free diet for 30 days, but have gluten 1 or 2 times during that month, can it cause a flare for pain, even if it's limited? It can, but it's very individualized. Again, some women are, some patients are completely gluten-free. They start to implement gluten back into their diet and they can tolerate it. Other people, they have one piece of bread or like one meal with gluten in it, and it sends them into a spiral, and they feel like they have to really kind of walk uphill to regain some of the benefits that they've had over the last few weeks. But everybody is different. Do I think one bite of gluten will disrupt everything you worked for the last few months? Probably not, but that day you may feel different. You may feel, some people get a headache or some people feel more bloated or you see a change in your diet. You certainly can. People with true celiac can, but when people, even without celiac disease, still sometimes can see a benefit from cutting out gluten because for many people, there is quite a bit of inflammatory process with gluten. Um, Somebody else said, what do you recommend when diet is up and down? Meaning sometimes a food will flare me up and sometimes it doesn't. Would you recommend just cutting that item in case it flares up sometimes? I think that it's a little bit of trial and error. But if you do feel that sometimes it flares you and it's reasonable to cut it out, I think that it would be good long term. Try to find a diet, that kind of works for you. And I realize that's hard because sometimes you're cutting out so many things. It's difficult. You feel like you have a skeleton closet or options to eat. There's becomes less and less. But there are a lot of dietary books, or meet with a nutritionist that can help you kind of go through some of your diet, and maybe something even in that food specifically, if it's not a whole food, that may be triggering you that you didn't even think about. Maybe like the sauce that's in it, or the spices that it's cooked with, or the oil that it's seared with. Those things can make a difference as well. Um, so let's see, they talk about medications that can help with bringing down inflammation, and we'll talk about that later in the webinar. Some more natural supplements that can work, and we do have nutritionists. Yes, I have a list of nutritionists that I hand out to my patients. Many of them do telehealth. Some are in Dallas specifically, some are in Austin. You can also call your insurance. Call your insurance and ask them which nutritionist is on my plan, and try to get in. But that is a great place to start. Not all nutritionists are specialized in endometriosis, but they can get you on the right path of kind of whole foods eating, and kind of this holistic approach, understanding your body, understanding how your body responds to different foods. And so that's a great place to start, is meeting with the nutritionist. They also give you some other options that maybe you didn't think about. Um, I know me personally, I have young kids, and so a lot of times I end up eating what they're eating, or what I'm what I'm making for them. But it's nice to have some other options. And a lot of times when I have my kids try it, they actually enjoy it. And so then it's a little bit easier for me to eat healthy and eat clean with them, kind of as a family, rather than having to fix multiple meals. Okay, so we talked about foods. Oh, influencers. One last thing. There is an endo nutrition Instagram person that I follow. I don't have her name right now, but I think her name is actually Endo Nutrition, and she talks about some of the kind of the inflammatory foods and how she has changed her life. And she is another one that is a huge advocate for diet and food as medicine in this endo space, because she has endometriosis, and she has essentially changed her life with her diet, which is really fun and interesting to see. All right, so we talked about how inflammation fighting foods can dramatically ease your symptoms, how to avoid foods that cause your body inflammation. Next, we're going to talk about acupuncture. So alternative therapies, this is a misconception, kind of a falsehood. Alternative therapies aren't scientifically proven and don't offer lasting relief. Well, that's absolutely false. There is a happy medium between Eastern medicine, Western medicine. Acupuncture actually has some great evidence behind it. And I'm not talking about, just going to get a foot massage, but actually people that are trained in acupuncture, that understand the role of acupuncture, not just in decreasing inflammation. And this is not what we're talking about today, but also there's been some proven fertility aspects with acupuncture. And it's important to not immediately brush off some of these other options, because it may not be something that you're comfortable with or something that you know very much about, but acupuncture does have some scientific backing behind it. Let's see. So I have many patients that do acupuncture. As most of you know, about half of my patients are fertility patients and the other half are pelvic pain. I've seen them more in my fertility patients, but have one specific patient who came in. She was trying for fertility, but she also just had debilitating pain. We did, an endometriosis excision surgery. She was trying to implement some of these other modalities, and she did start to implement acupuncture, and saw more of a benefit than she had with these other modalities still in place than she had before. And it wasn't just timing. It was about 4 months after surgery, she started doing acupuncture. once a week and was continuing to work through her diet, but her diet hadn't changed much, and she was able to really see a benefit not just from pain and then ultimately conceive. And it's hard to know exactly, is this the acupuncture that ultimately brought her, brought everything out, but it's a combination of using these different approaches and just treating your body, and only you know what is best for your journey with endometriosis. So again, this is not a one size fits all. um, Next, I would like to talk about physical therapy, and I could do a whole hour on pelvic floor physical therapy. So, for those of you that don't understand physical therapy or kind of heard about physical therapy or know what physical therapy is, pelvic floor physical therapy is very targeted to the pelvis and the muscles and the joints that innervate the pelvis. And they're all over the country, but in DFW, we probably have 50 to 100 of pelvic floor physical therapists. And some are better trained than others, but ultimately they are mostly women that work towards improving the muscles and the tension and how the pelvic floor kind of interacts with each other. Um, most pelvic floor physical therapists are women, and they help women with pelvic pain. Sometimes they can help with pregnancy or postpartum, but ultimately they're specialized in this space. And the nerves of the pelvic floor, or the nerves that innervate the pelvic floor, run through the muscles. And so when the muscles are not functioning correctly or they're tense, you can have spasms, and ultimately it can exacerbate your pain, or especially nerve pain, sharp stabbing pain. Sometimes in the pelvic floor, you can have, Charley horses or cramping in the pelvic floor. And this can be alleviated with pelvic floor physical therapy. I always try to explain this to patients. When someone is in chronic pain, or they have pelvic pain, their muscles tense. So if I punch you in your abdomen, you tense your rectus muscles. Like, you can't help it. It is your body's natural response. Same thing in the pelvic floor. These muscles are very strong. They hold up the whole body, like outside of the thigh, thigh and up. And when you're in pain, these muscles tense, and so they don't function very well. Sometimes you have urinary frequency or urgency. You can feel some bladder spasms. Some people have, rectal spasms, or have trouble like emptying their colon completely. Pain with intercourse is a huge one, because when you have this tension and you're afraid that it's going to hurt, it's a downhill spiral, because your body starts to try to resist, and these muscles tense up. I work with some amazing pelvic floor physical therapists, and outside of social media, this is probably where I get most of my referrals, because these women that work with their patients in pelvic floor physical therapy, they very much understand how endometriosis can affect the muscles, how can affect the ligaments, and the pelvis as a whole. They've studied this their entire life, and they are experts in this space. And so they understand how this inflammation from these muscles is giving you more pain, these secondary and tertiary effects from the endometriosis. Again, it doesn't make the endometriosis go away, but it helps you with managing it. Ideally, in an ideal world, a patient would have physical therapy before surgery, for a few months, to, one, help get a baseline, two, become comfortable with your physical therapist, but also give you tools so that after surgery, you have tools in your toolkit where you can kind of down regulate some of that inflammation. If the pain starts to exacerbate, you have tools that you can use to help with some of the pain. They don't just relax muscles, they also strengthen the pelvic floor. And a lot of that is actually what's needed. Even though you have tension, these muscles, while they're spasming, they're weak. So they spasm because they can't function appropriately. And so a thorough evaluating the pelvic floor and then getting a treatment plan in place is, to me, one of the best ways to help with pelvic floor pain, but also this holistic, anti-inflammatory response, because these physical therapists truly understand the pelvic floor, and they understand where your pain is coming from. Sometimes they can even pinpoint specific nerves that are affected by different muscles in the pelvic floor, whether the piriformis or the pelvic floor itself. You have the obturator internus. You have a lot of muscles that affect the pelvic floor, not with just bowel movements and bladder, but also with just daily functioning, even with walking. And sometimes if these muscles are not functioning appropriately, it can certainly exacerbate your pain. After surgery, it's also important to have pelvic floor physical therapists, because these the pelvic floor physical therapists are so specialized in this area. They help you get back to your baseline. They help you relearn where your body was before. But then as these tissues are remodeling after surgery, after the endometriosis has been excised, you can start to heal, and the muscles can strengthen without irritating or affecting the nerves that are running in these muscles. And it can help them start to not only recover, but learn to function without having this inflammatory response, because your body sometimes is so used to having pain and inflammation, it doesn't know how to live without it. And so using these other holistic approaches, especially in the form of physical therapy, can be invaluable in your journey with treating endometriosis. You know, again, we have multiple physical therapists in Dallas that are excellent, but there's also physical therapists really throughout the country. There's even um, websites you can use to search with your zip code. Where is a pelvic floor physical therapist? Somebody that has been, trained in pelvic floor physical therapy. Certainly, there are some that are better versed than others, but it's a great place to start because pelvic floor physical therapy is paramount in this recovery process of treating endometriosis and down regulating some of this inflammation. So, clinical evidence shows that acupuncture and targeted pelvic floor physical therapy can offer immediate and lasting reductions in pain and inflammation. So, this is giving you a long-term solution. This is not just short-term, especially with pelvic floor physical therapy, because it is retraining your body and it's giving you tools that you can use for a lifetime going forward. Um, Classically, I recommend patients work for ideally at least 2 months before surgery with physical therapy, and then they can restart between 2 and 4 weeks afterwards. And sometimes it's long-term physical therapy, but at least a few months afterwards to really get the full benefit. All right, so after talking about physical therapy, I'm going to go over to the chat. And again, thank you guys for interacting with me so that I'm not just talking to myself for an hour, but I do love getting to see some of your questions and some of your stories. Oh, back to the diet. Somebody mentioned that there's a dietitian and influencer. Thank you for giving that. I love learning more about that and finding more influencers or people that are advocating for endometriosis and some holistic approaches. So there's a few people on here that has talked about how pelvic floor physical therapy has been a game changer, a life changer, really. And I always talk to patients about that when they come into my office. When we talk about this multidisciplinary approach, we talk about, diet, we talk about physical therapy. Later, we're going to talk about exercise and acupuncture. And all of this is important, but physical therapy is paramount. And, we talk about surgery as well, but if patients decide not to do surgery or they're not ready, like we talked about earlier, sometimes it's unattainable. Please implement pelvic floor physical therapy into your routine, because once you get there, once you start seeing the results, you'll wonder why you weren't, referred there years ago. How long? So one of the questions is, how long do you see most women in pelvic floor PT? So what I mentioned was, ideally, in an ideal world, where everybody has a ton of time and limited finances, at least 2 months before surgery. And then after surgery, you can start at that 2 to 4 week mark. I usually say at minimum 3 months, but some people are there long term. I have patients that have used it for years, and they're still getting benefit out of it, and they're still seeing changes. And so I think physical therapy, really, you can't get enough of it. But I do understand that there's time and other factors that are influencing that. But I would say at least 3 months after surgery, if not longer. Okay, let's see. What modalities besides surgery? So we're kind of getting off topic here, but I do think that it's interesting. What modalities besides surgery would you recommend for endo when it affects the lungs? So ultimately, if there is true endometriosis in the thoracic cavity, at some point you will need to have surgery to have it removed, because you can have a pneumothorax. It can affect your breathing. It can be dangerous down the road. However, you still can implement these other secondary treatment plans and still see a benefit, and may be able to help you, manage some of your symptoms until you're ready to get to surgery. And even after surgery, sometimes people after surgery, their pain is not completely gone. And then they're terrified as this is how I'm going to have to live my life forever. But that's not the case. We start implementing these other modalities to help regulate the central sensitization of pain and this inflammation, and let your tissues remodel, let the nerves heal. You could still have good and even great outcomes even if immediately after surgery you're not seeing a benefit, because it does take time to heal from surgery and then let your body relearn how to not be, in pain or experiencing these symptoms every day. All right, so we went through diet, we talked about physical therapy, we hit on acupuncture a little bit. So now we're going to talk about movement and exercise. So yoga, movement, integrative modalities that strengthen your body's natural healing. And this is real. This is evidence-based. There's been evidence to show that the more active you are, it can help with this inflammation. So there's all these misconceptions and falsehoods. So movement worsens endometriosis, rest and surgery are the only answers. And that's not true. I can't tell you how many patients I've seen that love their Orange Theory workouts, or they're a runner. And they're like, I've told with endometriosis I can't be a runner anymore. And that's absolutely not true. Now, most of the research for exercise and movement has been more focused towards yoga and meditation. But that's not the only thing you have to do. You can do whatever brings you joy, whatever gives you that benefit. So I was explaining actually to a patient this morning of how exercise can help. And she has actually started to implement some exercise on her own. And while her pain has not completely resolved, she does notice that some of her bloating is down, her pain-free days are becoming a little bit longer, and she's just feeling better overall. When you exercise, your body releases some endorphins, which is a hormone. You get some kind of there's all different types of hormones in our bodies, but ultimately some of those hormones transition to steroids. Steroids are anti-inflammatory. So if you ever go to the urgent care and you get, you're like have a cold, and they always give you a Z-Pack and a shot of steroids. The steroids don't make your virus or bacteria go away faster. They just help you feel better because it's decreasing that inflammation. And that's what exercise can do for you in a physical way. This is not even discussing the mental health impacts of exercise, but the physical impacts of how it truly can, decrease some of your inflammation, improve your pain-free days, decrease the pain that you're feeling on this scale. And some of that is related to this anti-inflammatory effect of inflammation. And I've seen it in my patients. I can feel it in myself. Like when I'm exercising and following the things I can, I do feel that decreased inflammation, the decreased bloating, inflammation that you can feel inside your body, whether it's in headaches or drowsiness or fatigue. You can start to see some of those benefits. It's not easy, especially when you're in pain. When you're really hurting, it is very, very difficult to get motivated to be able to try to exercise. But I would recommend starting with strengthening, stretching, yoga, meditation, and working your way up, finding something that works for you. Sometimes it is truly a yoga class. Sometimes it's Pilates. Sometimes it's running. Sometimes it's running long distances. I have some people that are doing Orange Theory. Whatever makes you feel that void and gives you benefit. There's no exercise that's going to make your endometriosis worse. It can only be beneficial. It's incredibly difficult when you're in a lot of pain, again, to start implementing some of these treatment plans. However, long term, many people can see a benefit. And, with this holistic approach of diet, physical therapy, and exercise, it's just kind of the tip of the iceberg. But to give you some relief so that when you're in a better headspace, you can also make better decisions for your body and what next steps, what are best for you. Because remember, this is very much of an individualized approach. This is not a one size fits all. And I have many patients that come in and they're like, I've already tried all of these things. So what is next? And so we start going down the list and making sure we're not missing anything. And sometimes at that point, that's when we discuss surgery, but it is still very important to implement these, not only before surgery, after surgery, in lieu of surgery, but it can help your body, with the inflammation and ultimately longevity. So exercise, gentle yoga, all of these integrated practices not only reduce inflammation, but they empower your body's like innate healing process. And that's where you're getting some of that steroid response. And these approaches really are key components of holistic medicine, because when they all work together, they kind of compound, and that's when you get, better outcomes. Next, I also want to talk about some other medications outside of hormones that can help with some of the inflammation. So, turmeric has been shown to be very beneficial as an anti-inflammatory. It is a natural supplement. You can get it over the counter. This can be beneficial. You do have to be careful with taking turmeric and all of the NSAIDs, just because they can irritate your stomach. But that is an important thing to think about. DIM, there's a DIM. It's a supplement. It's supposed to help with some hormonal regulation, but especially women with adenomyosis sometimes notice when they take these, they can see some decreased inflammation. Most women are low in vitamin D, because we're not outside as much as we're meant to be. This is not necessarily an anti-inflammatory medication, but it's something that I implement in my daily routine. And it just for overall health and well-being, because ultimately, if we can optimize our body in the best ways possible, that's when we're going to have the best outcomes. That's where we're going to feel the best, and we can help manage our inflammation and our pain. And I am going to go back to the chat. So thank you guys again for being interactive, so I don't have to talk to myself the whole time. Someone asked if there was doctors in Houston. There are. Let's see. I think at Baylor there is a doctor that at least he does endometriosis surgery. I'm not sure if he does kind of the multidisciplinary approach, but I think that may be a good option to get into. Taylor Reyes on Insta has great info on endo. She does, and I know Taylor very well, and she is a huge advocate for endometriosis, and I appreciate that. And so, someone asked how to try to help with increasing progesterone and estrogen naturally. So sometimes that's very difficult, because there is an axis between the ovary, the adrenals, the pituitary, and sort of how it fluctuates with us. And so natural approaches to helping progesterone really are overall this whole body approach. Sometimes, though, even though you're implementing all of these holistic approaches, you may need to take a small supplement of progesterone, especially if your goal is fertility. It's not always the case, but sometimes, no matter how hard you work, your ovary or your pituitary, they're just not responding in the way that you need them to be beneficial. But these other ways of decreasing the inflammation ultimately are giving all of these organs that are secreting your hormones and in this axis of managing your progesterone and estrogen and these ratios, optimizing your overall health can give a proven benefit. And we do see that in the fertility world, especially, working on diet, decreasing alcohol when you're going through fertility, acupuncture. But again, just implementing kind of this holistic whole body approach is going to be your best bet. But if you do all of these things and you're still not where you want to be, then sometimes, unfortunately, a supplement may be the only way to really get your body kind of optimized for pregnancy. Let's see. Sometimes when I exercise, I feel inflamed afterwards, are the ways to mitigate that. And that's true. I see that sometimes with patients after they exercise, especially with a more aggressive exercise, they can feel some of the irritation of the pelvis. And I think some of that is related to like organs kind of moving around rapidly. You can always use ice after after exercise. Heat is also beneficial, making sure you're hydrating, of course, but ice may be a good option for that. Some people even do an ice bath after surgery. The longevity gurus talk about taking ice baths every day. I'm not sure there's a ton of evidence behind that, but immediate ice may be beneficial too, to kind of help decrease some of that inflammation if it's starting to get exacerbated. You can also consider tweaking your exercise a little bit to find one that maybe doesn't exacerbate your inflammation, but also we talked about both the physical, but also the mental health aspects of exercise and how they work together. So if there's something that you really enjoy, if you could maybe try ice or taking some turmeric, while like immediately prior to exercising, just to see if you can see some improvement there, so you can continue to do something that brings you joy. Let's see. I'm just going through. One patient said, "Have you ever had a discussion with a potential client that decided not to do surgery and change their lifestyle instead?" Yes, I actually see that a lot. And like we talked about at the beginning, surgery is not for everyone. I'm a surgeon. I see a lot of benefit with endometriosis surgery. Sometimes, it's not attainable for many, many different reasons. Rather, they don't want to take off work. It's too expensive. They're scared about the potential complications of surgery. But I see this actually all the time, and I still give them this layout for a holistic approach. It puts the ball in your court to try to implement a lot of these. Of course, I send referrals for physical therapists and nutritionists, but it can be overwhelming sometimes. And so it is really important to have this system in place of support, whether it's your family, whether it's your friends, whether it's social media, people with endometriosis understanding your struggles and helping support you, through through this journey, because endometriosis treatment is definitely a marathon, not a sprint. And so finding people that are like you, that can help you support you in some of your changes that you're doing, can certainly make it easier and seem more attainable. Let's see. So during my period, my pain can be so bad that ibuprofen and Tylenol don't make a difference. What do we do for medication at that time? That's really tough. There are other doctors that help with kind of this, like physiatrists or other doctors that help with, pain management. They can help you with muscle relaxers, medication specifically for nerve pain. Make sure you are maxing out your ibuprofen and Tylenol. So the dose of ibuprofen is 600 every 6 hours, or 800 every 8 hours. And then the Tylenol dose is 1,000 every 6 hours. Those are safe doses to take for multiple days at a time, even long term, but make sure you're maxing out those doses. And then don't forget about the ice and the heat. They can certainly help with that. Physical therapy can also give you some tools. So when your pain is starting to get exacerbated, to try to relax some of that pelvic floor, or give you other tools so that when your pain is getting worse and worse, it can down regulate some of that pain so it doesn't get to the 10 out of 10. But prehab or work prior to when you're getting these exacerbated symptoms is really key, so that hopefully you get fewer of them. Okay, so this is really important. I'm going to put in the chat a way to get a hold of me and how to book an appointment with my surgery scheduler. So this is not an appointment with me, but this is an appointment with my scheduler, so that you ultimately can talk to her. She can get all of your information, your insurance, and then she can help you schedule an appointment with me. And this can be telehealth. It can be in person. On Tuesdays, I'm in Plano. I have an office in Plano, and on Wednesdays, I have an office in Dallas. Ultimately, I'm subleasing a space right now, but ultimately we'll have a permanent spot over the next few months. But click on this link that I just put into the chat, and you'll be able to click on this, and it's a booking link to meet with Cyrus. Again, she's my surgery scheduler, and she'll be able to go over with you how to schedule with me, and she'll get you into a spot. I would love to see you, and it's fun to get to know some of you, even through this chat. Okay, max doses of ibuprofen and Tylenol. 600 milligrams of ibuprofen every 6 hours. Tylenol is 1,000 milligrams of Tylenol every 6 hours. Those are the max doses. But you've seen that endometriosis and inflammation can be managed effectively without having to have surgery or even aggressive medications that put you into menopause. It can be done. I've seen it in my patient population. Yes, I think surgery is an important tool, but it's not the right tool for everyone. And even if you do have surgery, implementing these more holistic and multimodal approaches is going to give you your best outcome. So if piecing all of these strategies together feels overwhelming, you're not alone. We talked about the importance of having a team. And so a simple guided approach to managing, your inflammation comprehensively and naturally, I'm here. I'm here to help you kind of through this to trudge through and see what's best for you, what we should implement first, what we should implement next. Ideally, we would implement a lot of them at the same time to get our best outcomes. But again, it's not a one size fits all. And so when you meet with me, I give you an individualized approach. We talk about where your symptoms are, what symptoms you're having, and what the next best steps are. Rather it's this holistic approach, rather it's discussing surgery, rather it's implementing them all at the same time. But the importance of doing this all together is paramount. So physical therapy is the number one. It's imperative to make sure you understand your pelvic floor, and it gives you tools to help you when your pain is exacerbated. Diet, I do think, has seen huge benefits in many of my patients. It's difficult to do, but when you do it and do it well, especially if you have somebody helping you, like a nutritionist or a book that you can follow, kind of following these clean eating habits, that can be helpful. Acupuncture can be helpful. And then, we didn't talk about it at this visit, but there are some hormonal treatments that can be beneficial. It is not for everyone. I definitely don't push medications on my patients because sometimes they have side effects. Some people just don't want to take them, and that's certainly okay. But I think it's important to make sure that patients understand all of their options so that they can make the best decision for them. And it is certainly not a one size fits all. So use the link and meet with me. We'll get a detailed assessment of identifying your personal, struggles and how endometriosis is affecting you and your inflammatory responses in your body. And so we'll talk about, an integrated plan, talking about diet, acupuncture, pelvic floor physical therapy, exercise, adjusting your lifestyle. We will discuss surgery, but there are ways that we can try to help with the pain and downregulate the inflammation even without surgery. And so you'll meet with me. A lot of my patients have had multiple providers that they're seeing. They're seeing a GI specialist, they're seeing a urologist, and they're seeing their general OB, or their primary doctor, and trying to find answers to this. And we can do it all in one place. We will go through and treat you as a whole with a multidisciplinary approach, and that's when we get our best outcomes. And endometriosis is very much a whole body disease. It is a chronic inflammatory disease of your body, and it is important to address all aspects of endometriosis and the inflammation. So when you meet with me, if this is not for you, you have a fully refundable consultation there. I do not want you to feel like you came and met with me and didn't get anything out of it. I'm here for you. I will listen to you, and we'll make a plan together. And I want to make sure that you feel like you've been heard and feel like we have a plan in place that's for you specifically. So I'm going to go back to the chat and see if there's any other questions. Let's see. I have an appointment scheduled with you in July. Is there a benefit to booking an appointment with your scheduler? If you already have an appointment with me, just keep it, because you probably won't be able to get an earlier appointment. You can always reach out to us and see if there's any cancellations, and we can try to get you in earlier if somebody drops out. But if you do already have a visit, you don't need to make an additional visit with my scheduler. Somebody said, at what point do you recommend excision surgery? I think this is very much a quality of life issue and a personal decision. My goal in my career is to try to treat women earlier, catch the disease earlier, so we have a better chance of it not recurring, better chance of it not affecting fertility, of the long-lasting sequela of chronic inflammation around your nerves and your muscles. It's harder to reverse the longer it stays there. But again, while I feel that surgery gives a benefit to a lot of women, it's very much of a personal choice. And so, it's something that we discuss together, but certainly something that you have to decide and listen to your intuition and when you feel that the time is right, because it is a big decision, but it's important to make sure that your surgeon is very versed in endometriosis and feels comfortable removing, endometriosis from wherever we find it, so that your first surgery is truly an excision with no endometriosis left behind, and that's where you're going to have the best outcome. Okay, my pain is mostly during ovulation. It's there during my period as well, but before and after. Is it common to have ovulation pain with endometriosis? And it very much is. When there's inflammation, your kind of heightened sensitivity in your pelvis. So something like ovulation, while it usually doesn't cause excruciating pain for most women or women without endometriosis, women with endometriosis, they may feel excruciating pain because they already have this, their threshold is already raised for inflammation and pain. And then when you have ovulation, even though it may be a mild insult, it kind of puts you over the top. That can certainly cause more pain and disruption. So I do see that a lot, actually, more pain with ovulation during their cycle. And usually that is a progression, kind of starts with pelvic pain during their cycle and then progresses to pain with ovulation. But I've mentioned this before, but endometriosis does not follow the rules. And so it can present in many different ways for many different patients. And so that's why it's so important just to listen and understand a patient individually and be able to tease out what symptoms are related to endometriosis, maybe what symptoms aren't related to endometriosis, but most of the time we don't know because it's such a vast disease that affects so many different organ systems. Well, thank you guys for meeting with me. I enjoyed talking with you for this last hour, and remember that endometriosis is it's a multi-system whole body disease. By treating this as a holistic multidisciplinary approach, you do get good outcomes. It doesn't mean that it completely avoids, surgery or more invasive medications, but for some women it does. Sometimes this can be really what you need, but even if you do ultimately have surgery or you ultimately do need medications like birth control pills or progesterones, it is still imperative to implement these other multidisciplinary holistic approaches so that you get your best outcome, because this is what's going to give you longevity. This is what's going to help you in the long term, not just with your quality of life, but your daily functioning. Decreasing that inflammation is also going to help you with reversing some of that sequela from the endometriosis that's been there for so long. So I'm looking forward to meeting you guys. I'm hoping to see some of these names on my schedule in the next few weeks. But I would love to see you and have this integrated consultation with you and talk about your options for endo treatment, and see how we can give you an improved quality of life. So again, my name is Dr. Rachael Haverland. I'm with the Endometriosis Center of Excellence. You can use this. I'm going to put it again in the chat. So if you don't have an appointment with me, you can use this link to schedule with my surgery schedule or my clinic scheduler. Her name is Cyrus, and she'll be able to get some information from you and get you the first available appointment. And I look forward to meeting with you and talking with you, and learning more about you individually. So y'all have a good rest of your week and happy Wednesday. I will see you next month. So we're going to do monthly webinars and talk about something different about endometriosis. So today was not a surgical discussion. It was talking about less invasive treatment options. And next month we'll do something similar, so we can talk about another aspect of endometriosis and how it affects you, and how hopefully we can find some treatment options. So y'all have a good rest of your day, and yeah, look forward to seeing some of you soon. Bye-bye.